So why do we get knee pain? Hi, I'm Cam, and I'm from the Athletic IQ team. So knee pain, it's really becoming a common occurrence, especially for people who participate in moderate to high frequency exercise. So today, I'm going to show you some corrective techniques that may help you to improve your mobility and also maybe help rehabilitate two of the most common causes of knee pain. One of them being the iliotibial band or friction syndrome, and also the other one being the patellofemoral pain syndrome. So there are quite a few different opinions and ideas of how both syndromes occur, but most literature and research suggests that the pain is actually the result of the kneecap or the patella not tracking smoothly through the groove in the underlying bone where the leg is bent and also straightened. So how do we identify them? You can actually try this self-evaluation, and it's a slight modification of Clark's test. However, it's still an effective way of identifying if your kneecap is not tracking correctly. So step one, place your leg on a bench as if you were trying to do a hamstring stretch. Step two, relax your whole leg completely, especially the quadricep. Step three, flex your quad and pay close attention to your kneecap. What you'll see here is that this test actually allows you to see your own kneecap or your patella and see how it's tracking. If you notice that it's being pulled laterally, so outwards towards the outside of the knee, then you most likely have a tight outer leg muscle or muscles, for example, the ITB, and also the possibility of pain if you haven't already presented with that pain. So how do we rectify it? Or how do we prevent it? A really good way to assist with rectifying and also preventing further knee pain is foam rolling. So why foam roll? So the muscles are surrounded by a soft tissue known as fascia. So it's like a deep tissue. It's thought that this tissue can influence flexibility and joint range of movement. Research suggests that using a foam roller is a form of self-myofascial release or trigger point release, and that it makes the fascia more flexible and also breaks down the scar tissue and also any adhesions that you might have in the actual fascia. So how do you do foam rolling? Really good way of starting off, especially if you're presenting with any knee pain, is to start with an ITB release. This foam roller exercise is basically designed to reduce ITB tension. So, as the name suggests, it is a band. The ITB is basically a connective tissue band that runs down the lateral side or the outside of your thigh and attaches at the lateral surface of something called the tibial condyle, or otherwise known as the outside of your knee joint. The ITB basically originates from the tensor fasciae latae, which is your TFL, or basically where your hip is. This syndrome occurs due to the ITB band tissue causing friction or rubbing on the femur, which is your bone, because the iliotibial band is tight against it. This basically leads to the knee not tracking correctly, and generally it'll actually pull it across and make it track laterally. Therefore, the ITB is tight and pulls the patella across and outwards, and ideally your solution is to reduce that tension in the ITB. Start by placing the foam roller under your ITB or your outer thigh, just below the hip, as demonstrated in this video. Using your arms, slowly move your body up and down the roller, allowing it to massage the outer thigh. So I really suggest that you use a scale, a pain scale. So this scale is a scale between 1 and 10. 1 being you feel very little pain, 10 being you feel extreme pain. If at any point you experience pain, where the pain reaches approximately an 8 out of 10, hold on that spot for about 10 to 15 seconds, breathe and relax until the pain subsides to about a 3 or 4 out of 10. Trust me, breathing helps. Repeat the process for the whole ITB, so all the way from the hip, all the way down to the knee, and if you can, go all the way back up as well, to the hip. As long as it doesn't cause excruciating pain, continue with it. You can perform this with both legs on the ground, off the ground, one on top of the other, or if that's too much, take the top leg off and pull it either behind or in front. The next exercise that we can use with the foam roller is the glute release, or otherwise known as your buttocks. So this foam roller exercise is basically designed to improve your glute flexibility. And at the same time, it can probably alleviate some of your lower back pain that you're having if you do it in combination with some hamstring stretches and some hamstring releases as well. So how you would do this, place the foam roller underneath your glute or buttocks on one side. You can do this with a hard ball as well. So the likes of a hockey ball is really good, a cricket ball, or the massage ball that you saw before. You may notice that this is a normal glute stretch on top of foam roller. However, what I want you to do is rotate to the side you're stretching on. And again, using your arms and leg, slowly move your body forwards and backwards, allowing the foam roller to massage your buttock region. Breathe normally, like last time. Keep your legs relaxed and wait for the pain to reduce to a 3 or 4 out of 10 again. Repeat the whole process as long as it doesn't cause any excruciating pain. Okay, so now we've got one more, which is hip flexor release. Basically, the foam roller exercise is designed to improve your hip flexor flexibility and also relieve the quad a little bit. What I want you to do is place the foam roller under your hip flexors, basically the front of your upper thigh and your pelvis area. Basically, using your arms, again, slowly move your body forwards and backwards, allowing the foam roller to massage the front of your hip and pelvis. Repeat the process, again, all the way down, all the way up for the whole quad. Basically between the knee and the hip, as long as it doesn't cause excruciating pain. Again, stop at any points that are actually quite sore. Wait for the pain to go. Thank you for watching this episode on recovery. I hope you enjoyed it. Please make sure that you also click the subscribe button to ensure that you get all of our videos that are coming out. And also make sure that you check out our Athletic IQ clothing line that's actually come out. We started off with these t-shirts right here. They also come in singlets, T-backs, muscle shirts. and we've got a big range coming out very soon. Also, make sure you don't forget to like our Facebook page. We put up a lot of our information there, and also check out our blog. Thanks.